My name is Jake Greenberg, and I'm an associate professor of surgery, and I have a practice in minimally invasive and bariatric surgery here at the University of Wisconsin. So I think one of the biggest questions that most patients have as they go through our program is which operation or which procedure is the right choice for them. And that is a question that we spend a decent amount of time talking to you about as you move through our weight management program. Historically, there were several choices for different operations, and more recently, there were three, and now really we're kind of down to two. The three that were done up until the last decade or so were the lap band, the sleeve gastrectomy, and the gastric bypass. The lap band has really kind of fallen out of favor as of recently due to high rates of long-term complications like band erosion or slippage, and really most importantly because it just wasn't all that successful in creating weight loss for patients. The sleeve gastrectomy and the gastric bypass are the two operations that we do the most. And when you sit down and meet with your surgeon to discuss which operation is the best for you, that's likely what they'll spend the most time talking about. Both of these operations are done laparoscopically, so through small cuts. Both of them require about 1 to 2 nights in the hospital and usually about 1 to 2 weeks or so worth of recovery. But there are some significant differences between the two, both with respect to how and why you lose weight and also some of the risks associated with them. So we'll start with the sleeve gastrectomy. The sleeve gastrectomy is an operation really on the stomach alone. Using the laparoscope, which is a surgical camera and special instruments, we get rid of the blood supply to the left side of the stomach, and we basically staple off and remove a large portion of the stomach, but the rest of the GI tract stays untouched. So your small intestine, your large intestine, we don't do anything to those. We're really just removing a piece of the stomach. That operation helps to have you lose weight through a couple different mechanisms. First and foremost, with a smaller stomach, you don't have the capacity to hold as much food, so patients tend to feel full much sooner than they have in the past. And so usually the meals that you eat are smaller. Additionally, that portion of the stomach secretes a hormone called ghrelin. That's a hormone that makes you hungry. And after you eat, those levels usually go down and you're no longer hungry. When we take out that portion of the stomach, that hormone goes down and stays down. So most patients lose their hunger or urge to eat for about the first 12 to 18 months. And with time, it generally starts to come back. So usually we'll see patients lose on average about 60% of their excess weight over the first year. And that's the difference between what you weigh now and what you should weigh based on your age, your height, and your sex. With the gastric bypass, it's an operation both on the stomach as well as the small intestine. And there, nothing gets removed, but we reroute the plumbing. We divide the stomach into a small pouch and then divide the small bowel into 2 pieces as well. The bottom half of that comes up and connects to the small gastric pouch that we've created, and then the top half reconnects to the small intestine a little bit of the ways down. So with this operation, much like the sleeve gastrectomy, there's again a much smaller stomach, and so again you will feel full much sooner than you are used to. But now there's also about 120 to 150 centimeters of small intestine where food's going through it, but it hasn't yet mixed with the digestive juices that your body needs to absorb the nutrients in that food. And from that second connection where we reinsert the small intestine to the small intestine, from that point down everything gets absorbed and digested just like it normally should. So here you have not only again that the decreased hunger, the feeling of early satiety or feeling full sooner than usual, but you also have a little bit of malabsorption, so you don't absorb all the nutrients as you normally would. And so with the gastric bypass, we see patients lose on average about 65 to 70% of their excess weight over the first year. So a little bit more effective early on. Over the long term, the two operations seem to be about equivalent in terms of overall weight loss. There's really very small differences between the two. And that's because over the long term, both of these operations are really tools to help you lose weight. And the thing that makes you successful or potentially unsuccessful is you using that tool appropriately. And for people that can change their lifestyle, increase their exercise, improve their diet, they can be successful with either one of these. In terms of the risks or the difference in the risks between the two operations, there are some risks that are more specific to the sleeve. Primarily that's reflux. By creating a smaller, more narrow stomach, we do increase the risk of reflux and reflux-related symptoms. And with the gastric bypass, it's ulcers or internal hernias. And those occur because of the way that we reroute the gastrointestinal tract. Any of those problems can potentially require future surgery. But again, for the most part, the rates of complications, especially those severe or worrisome ones, are very low with both of these operations. And so I know, speaking for myself and I think for the rest of the surgeons in our group, we both feel that these operations are outstanding operations to help you and your overall health and your weight loss goals.